So I hope you guys are having a good lunch. All right, we can get started. Next slide. So our office is the Office of Primary Care and Rural Health, as Assistant Commissioner Hornsby had mentioned. And so our name actually stems from two HRSA-funded grants that we receive, and we've received for about 30 years. And I know they've mentioned it over this past morning, and so I won't go into too much details, but we are the State Office of Rural Health. And so our job is really to help increase the capacity of rural health providers and stakeholders in the state by collecting and disseminating up-to-date information, addressing and identifying rural health issues that are happening in New Jersey, collaborating and coordinating activities to really ensure that we're maximizing our effort, and then providing any type of technical assistance and making sure that we are encouraging the recruitment and retention of workforce in rural areas of New Jersey. Next slide. So I know there's been quite a bit of a conversation around the federal definition of rural, but every state also has their own definition. And so based on New Jersey's definition, within 500, anybody or any region that has 500 people per square mile or less would be considered rural. And so based on that definition, even though we are quite densely populated, as you can see, we still have our rural issues. And so we have 7 rural counties that fall into that, under that definition, and then sub-counties. And so these Burlington, Gloucester, Monmouth, Morris, and Ocean would be considered the sub-counties. I also want to just pay attention to the idea that while in Jersey as a whole and within the United States, there are population increase over the past 10, I guess we're going on 12 years or 11 years, in our rural areas, there has been a decrease in population. And so often when, people are moving out of certain counties, economic opportunities tend to leave, health workforce tend to migrate to other places. And so that always poses an issue, an additional issue with make sure that all of the different social determinants of health and access to care is actually occurring. Next slide. All right, so on our other side, our primary care unit, so we essentially really work to make sure that we're understanding all of the primary care issues that are happening across the state. What are the health workforce issues? What are the emerging or health disparities that we really should be paying attention to? We work to identify the providers in the state. So we want to understand, what is the provider to patient ratio? Where are providers? Are they, people move, people pass away, people retire. And so we're constantly trying to maintain this up to 31,000 providers to ensure we have an adequate understanding of what's happening in the state. And we know if there's an area that, let's say, has a high level of homeless people, then we have providers that are actually able in that area that could match. That can, provide preventative medicine to that population. Or if we're in an area that's geographically, let's say medically underserved area and there are less providers, that's also something that we really need to know. And then we also want to understand, what are the access patterns? How hard is it to get to a mental health facility if you live in, Salem County? And so that is also part of our purview. And understanding the health workforce shortage issues then helps us to, therefore try to promote all of the national workforce plans and initiatives to really help get the providers that we need to our state and to the rural areas that are really needed. And beyond that, our goal is really just to increase access and ensure that we are advancing health equity. Next slide. So one of the newer programs within our unit is through the American Rescue Plan Act. And this has really enabled us to help organizations increase, educational outreach, equitable access to vaccinations and testing, as Mr. Hornsby had mentioned, as well as many other people in this conference. Rural areas have really been impacted, underserved areas, underserved populations have really been impacted by COVID. And so these grants really enable us to help support the health providers that are out there on the ground doing that work. Next slide. And this has also been reiterated quite a bit, but Jersey, while we are a densely populated state, we are not immune to the issues that most rural America encounters. And so these are part of those issues as well, and we'll go into that a little bit. Next slide. All right, so, poverty, when it comes to, or in general, when it comes to rural New Jersey, we're not a monolith, right? So the ranges between, areas that have lower than average poverty versus if you start moving down to the south, where we start to have a little bit more poverty and uninsured rates than our state average, which is about 9%. And so you'll see that the issues might vary based on where exactly you're living. So even though we're, those in Sussex County and Atlantic County might be both in rural counties, the resources might be a little bit different, or at least the economic opportunities might be a little bit more different, which then leads to other issues. Next slide. All right, so when we end up talking about access to care, we often anchor that in access to care for vulnerable populations, which therefore then leads to our FQHCs. And so in Jersey, we have 24 FQHCs, 135 sites. They serve over nearly 600,000 people per year, and 31% of that population are uninsured. So our uninsured for Jersey is about 7%, and 31% are being serviced in this population. 50% are on Medicaid, so half of our populations are on Medicaid, and 5% are in Medicare. Next slide. So now if we kind of drill down into our rural areas, we have 4 rural FQHCs in the state. Zufall, which is our host today, Ocean Health Initiative, Southern Jersey Family Medicine, and Complete Care. And so these 4 entities really service 30% of all FQHC, all FQHC patients in the state. Next slide. All right, so in my slides, I think 2 or 3 slides ago, I had mentioned that their FQHCs in general service about 31% on average, service about 31% of uninsured patients. And if you can see, that is a bit higher in some areas in our rural areas, or rural New Jersey, and so as well as Medicaid patients, right? So we said half, and in some areas, looking at Ocean Health Initiative, it's a little bit higher than half, and so the need is definitely there in these areas, and it's really important to recognize just kind of the unique issues that occur within our rural areas and why the rural FQHCs are incredibly important to the work that we do. Next slide. So one other way that we work, as a state, help to ensure that uninsured folks get access to care is through the Uncompensated Care Fund. And so this fund is about 30 years old, and it's unique to New Jersey. It's state funded, and it really enables our office. So this is our other program, but it really enables our office and this, Department of Health in general, to ensure that every resident has access to preventative medicine and preventative care. Not just emergency care, which, as we know, is incredibly costly, and often is, people are often seen at the late stage of whatever chronic disease or illness that they have. And so our goal is to really push preventative care as much as possible, and this enables us to do it. Next slide. And so the services that we reimburse for are primary, dental, mental health, which was established this year, and then telehealth, which was established due to the pandemic. 23 out of our 24 FQHCs are participating in the Uncompensated Care Fund. And I think the 24th right now is it's a new FQHC, so they're, at some point they might be. And the patient population, because it's awfully uninsured, happen to be undocumented, often, as I said, uninsured, and those who have 250% or below the federal poverty line. Next slide. So as you can see, our FQHCs, they really do provide a great deal of care to uninsured populations through the uncompensated care. So thousands of patients are able to get primary and dental care every year. And our goal is really to address those are, health disparities and health indicators, but also eventually get to the point where we're addressing social determinants of health and all the barriers that are leading to some of the issues that people have. Next slide. So I wanted to focus on some of the more frequent services that we reimburse for. And I really want to hone on this because this is where the preventative medicine comes from, really comes really becomes important. And so without being able to access that preventative medicine, like OBGYN exams, hypertension, screening for type 2 diabetes, type 2 diabetes management, as well as an oral examination, and the comprehensive oral exam, without being able to do these services or to really see patients for these services, we would have a higher rate of preventable deaths. And our goal is really to avoid that. And so it really is important to understand how critical that preventative measures are. Next slide. And since, as I mentioned, we had started reimbursing for mental health earlier this year. And in this year alone, and I mean, quite frankly, the fact that it's happening during the pandemic has really been important. And what we've seen specifically within the rural FQHCs is that these are the top mental health issues that people have come in with. And so, as we kind of work our way through the pandemic and try to find a new normal, a lot of these issues are really starting to come to focus, and we really do need to ensure that we're providing as much resources to people, regardless of insurance, regardless of documentation, regardless of income, ensuring that everybody has access to the basic needs, in which are primary dental and mental health care.